This is what we think is the situation today in Gaza. A situation where nobody is safe anywhere, and a situation where we see a systematic pattern of indiscriminate violence against civilians, a destruction of all the essential services, and the destruction of all the conditions necessary for life. So we see that this happens repeatedly, and the civilians have been targeted by the Israeli forces. We had attacks in all neighborhoods. Many families. I think every family must have lost at least one of their members, and many more. And as you mentioned, we had a huge number of health care workers and humanitarians, next to, of course, the journalists that they lost their lives. So overall, it is something unprecedented. It's something that we could never imagine, and has devastated all of us. And when it comes to the healthcare workers, I'm amazed with their courage. And I'm amazed because after 15 months, they are still there. They don't abandon their patients, which of course is what medical ethics always tell us to do. But under these circumstances, it takes extra effort, emotional effort also, and courage. And the situation in Syria changes constantly as we speak. So being afraid of an explosion, I'm not sure, but politically speaking, is very difficult to analyze what is happening and what to expect. However, as Médecins Sans Frontières, as MSF, as Doctors Without Borders, I want to remind to you that since the beginning of the war, back in 2011, we never
Yes.
managed to have access inside Damascus or in other areas that they were controlled by the government of Assad those days. Our main presence were in other areas in northeast and northwest. And still today, we are negotiating this access to Damascus. We are quite optimistic that soon we may get something that will let us have the global picture of what is happening in Syria, because we don't have it. In Lebanon, more than 220, 226, the official numbers of people, healthcare workers that lost their lives, they were killed, and more than 200 injured, only in Lebanon. Of course, in Gaza, it's a record high number of more than 1,000 healthcare workers, based on the data that we get from the Ministry of Health in Gaza, but also more than 350 humanitarian care workers. These are the numbers that we get also from UN and OCHA. In Sudan, it's been almost 2 years since April 2023 that the war started. There have been massacres and systemic war crimes happening there, and the war didn't pay much attention. And what we saw was a massive displacement of people, both internally, but also in the neighboring countries. We saw millions of them fleeing, reaching safety. And we know that this right moment, almost 200 million, 20 million people are in humanitarian needs. This means that they don't have even the very basics to keep them in life. This is the situation. This is the situation in Darfur, where we
Yeah.
see in the camps kids and pregnant women really suffering, struggling to stay alive. There are serious concerns about food insecurity in most of these places, and of course, in even in Khartoum, there's a lot of violence. There's no access to these people. The hospitals don't function as we would like to. And we, as MSF, also have sometimes to suspend activities because of security or because we don't have the material. We had to suspend surgical activities because we don't have all the supplies. So there's no access. They don't let the humanitarian aid go in. And also on top of this, there's so much violence in most of these places. This is the situation today. And I'm sorry to say that we have failed also as international human and the international community to respond to that. I'm sure that both the United Nations agencies and other organizations can do much more. They have to come with more international staff there, with more presence on the ground, and start coordinating some humanitarian response. But this is not because the two warring parties are not willing at all to come to any to come to this end. And as you asked, there's no political willingness by all other states to really provide the solution to this conflict. Interestingly, the last years we have seen a pattern of attacks to the humanitarian and human care, to the medical aid, as we call it. We have seen attacks, systematic attacks in the hospitals, the killing of humanitarians and healthcare workers. And we have also seen rape, as always, and starvation. All these are, I would say, are weapons of war at the end of the day. They have made them weapons of war, which is, of course, unacceptable. But this is the reality. This is the reality we see in Gaza. This is what we see in Sudan these days. And what I would insist, again, for the international community is not to let this become a new normalcy. Well, while I'm always hopeful for the best, I am afraid that this year will also be quite dystopic in terms of lack of respect to the laws, a disregard to the human life itself. It will be very challenging for the humanitarians to access the people or wherever they are. It will be quite hostile. We see more and more this pattern of attacks and even criminalization of our humanitarian aid in many places in the world. And we see a whole world that is going more and more to the far right, which I'm afraid will be overall an attack to humanity. And that's where we need to focus now, to the basics. This is something that we haven't lost. This is something that my people in Gaza haven't lost. When you asked me before about how they cope with this everyday life there, this is what all our communities, our patients are trying their best in Sudan, in Ukraine, in Myanmar, in Haiti. It's because they still hope that something may change. But optimism, not at this moment, I'm sorry. Diseases, when a healthcare system is under attack and when it's malfunctioning or not functioning at all, then people will not have access. People will not get their vaccines. Pregnant women will not have safe deliveries. Diabetic people will not have their insulin. Chronic diseases, blood pressure will not be regulated. And then, of course, we will have a series of communicable diseases because of the bad living conditions, the health conditions, the water sanitation is not there. We may have waterborne diseases, and and this is just the tip of an iceberg. There are many invisible uh, deaths that happen in all these places just because we're not there to see them. They cannot access the health facilities, and this is what I'm worried more about.